When it comes to managing chronic pain, hydrocodone and oxycodone are two commonly prescribed opioid analgesics. However, understanding the differences between these medications is crucial for patients and healthcare providers alike. In this video, we will compare hydrocodone and oxycodone to help you make an informed decision about which one may be more suitable for your pain management needs. Hydrocodone and oxycodone belong to the same class of drugs known as opioid analgesics or narcotics. They work by binding to opioid receptors in the brain, blocking pain signals and providing relief. While both medications are effective in treating moderate to severe chronic pain, there are key differences to consider. For instance, hydrocodone is often combined with acetaminophen to enhance its effectiveness, whereas oxycodone is typically used in its pure form. Additionally, hydrocodone tends to be slightly less potent than oxycodone. Understanding the nuances between hydrocodone and oxycodone can help tailor pain management strategies and prevent potential side effects. Keep reading to delve deeper into the comparison of these opioid analgesics in order to make an informed decision with your healthcare provider. What is hydrocodone? Hydrocodone is a semi-synthetic opioid derived from codeine. It is primarily used for the treatment of moderate to severe pain. Hydrocodone works by binding to opioid receptors in the brain and spinal cord, thereby reducing the perception of pain. It is often combined with acetaminophen, a non-opioid pain reliever, to enhance its analgesic effects. Hydrocodone is available in various formulations, including immediate-release and extended-release formulations. Immediate-release hydrocodone is typically used for acute pain relief, while extended-release hydrocodone is used for chronic pain management. The combination of hydrocodone and acetaminophen is commonly known by brand names such as Vicodin, Lortab, and Norco. It is important to note that hydrocodone is a controlled substance due to its potential for abuse and addiction. Therefore, it should only be used under the supervision of a healthcare professional and as prescribed. What is oxycodone? Oxycodone is a potent opioid analgesic that is primarily used for the treatment of moderate to severe pain. It is derived from thebaine, a natural alkaloid found in the opium poppy. Unlike hydrocodone, oxycodone is typically used in its pure form without any additional non-opioid pain relievers. Oxycodone works in a similar manner to hydrocodone by binding to opioid receptors in the brain and spinal cord. This binding action helps to block pain signals and provide relief. Oxycodone is available in immediate-release and extended-release formulations. Immediate-release oxycodone is often prescribed for acute pain, while extended-release oxycodone is used for chronic pain management. Like hydrocodone, oxycodone is a controlled substance due to its potential for abuse and addiction. It should only be used under the guidance of a healthcare professional and as prescribed. Mechanism of action of hydrocodone and oxycodone. Both hydrocodone and oxycodone exert their analgesic effects by binding to opioid receptors in the brain and spinal cord. These receptors are part of the body's natural pain management system. By binding to these receptors, hydrocodone and oxycodone can block the transmission of pain signals and reduce the perception of pain. Hydrocodone and oxycodone primarily bind to mu-opioid receptors, which are responsible for mediating the analgesic effects of opioids. These receptors are found in various regions of the central nervous system, including the brain and spinal cord. By activating mu-opioid receptors, hydrocodone and oxycodone can modulate the release of neurotransmitters involved in pain transmission. In addition to their effects on pain perception, hydrocodone and oxycodone can also induce feelings of euphoria and sedation. These effects are mediated by the activation of other opioid receptors, such as kappa and delta receptors. However, it is important to note that the activation of these receptors can also contribute to the potential for abuse and addiction associated with these medications. Comparison of efficacy and potency. When comparing the efficacy of hydrocodone and oxycodone, studies have shown that both medications are effective in managing moderate to severe chronic pain. However, the potency of these drugs can vary. Oxycodone is generally considered to be more potent than hydrocodone. This means that a lower dose of oxycodone may be required to achieve the same level of pain relief compared to hydrocodone. However, the exact potency ratio between these medications can vary depending on individual factors, such as the patient's tolerance and response to opioids. It is important to note that the choice between hydrocodone and oxycodone should be based on individual patient needs and considerations. Factors such as the severity of pain, previous opioid exposure, and potential drug interactions should be taken into account when selecting the most appropriate medication. Side effects and safety profile of hydrocodone and oxycodone. Both hydrocodone and oxycodone can cause a range of side effects, including constipation, nausea and vomiting, drowsiness, dizziness, dry mouth, itching, sweating. These side effects are common with opioid analgesics and are typically mild to moderate in severity. However, more serious side effects can occur, including respiratory depression, which can be life-threatening. Therefore, it is important to use these medications under the supervision of a healthcare professional and as prescribed. Additionally, hydrocodone and oxycodone can interact with other medications, such as benzodiazepines and alcohol, to increase the risk of respiratory depression and sedation. Patients should always inform their healthcare provider about all medications they are taking to minimize the risk of potential drug interactions. Addiction potential and abuse of hydrocodone and oxycodone. One of the significant concerns with opioid analgesics, including hydrocodone and oxycodone, is their potential for abuse and addiction. These medications can produce feelings of euphoria and relaxation, which can lead to misuse and dependence. Hydrocodone and oxycodone are both classified as Schedule II controlled substances by the Drug Enforcement Administration, DEA, in the United States. This classification reflects their high potential for abuse and addiction. Patients should be closely monitored when using these medications, and healthcare providers should follow prescribing guidelines to minimize the risk of misuse. It is important for patients to be aware of the signs of potential opioid addiction, such as craving the medication, using it for non-medical purposes, and experiencing withdrawal symptoms when attempting to stop its use. If addiction is suspected, patients should seek help from a healthcare professional or addiction specialist. Legal considerations and regulations. The use of hydrocodone and oxycodone is regulated by various laws and regulations to prevent misuse and diversion. In the United States, these medications are classified as Schedule II controlled substances, meaning that they have a high potential for abuse and are subject to strict prescribing and dispensing regulations. Patients must obtain a valid prescription from a licensed healthcare provider to legally obtain hydrocodone or oxycodone. The prescription must be filled at a licensed pharmacy, and patients may be required to provide identification and sign a controlled substance agreement. It is crucial for patients to follow the prescribed dosage and duration of treatment. Sharing or selling these medications is illegal and can result in serious legal consequences. Choosing between hydrocodone and oxycodone for chronic pain management. When it comes to choosing between hydrocodone and oxycodone for chronic pain management, several factors need to be considered. These factors include the severity of pain, individual response to opioids, potential drug interactions, and personal preferences. In some cases, hydrocodone may be preferred due to its combination with acetaminophen, which can enhance its analgesic effects. However, if acetaminophen is contraindicated or if a higher potency opioid is required, oxycodone may be a more suitable option. Ultimately, the decision should be made in consultation with a healthcare professional who can assess the individual patient's needs and provide personalized recommendations. Conclusion: consultation with a healthcare professional. When it comes to managing chronic pain, hydrocodone and oxycodone are both effective opioid analgesics. However, understanding the differences between these medications is crucial for making an informed decision. Factors such as potency, side effects, addiction potential, legal considerations, and personal preferences should all be taken into account. It is important to remember that hydrocodone and oxycodone should only be used under the supervision of a healthcare professional and as prescribed. Regular monitoring and open communication with your healthcare provider are essential for safe and effective pain management. If you have any questions or concerns about hydrocodone, oxycodone, or any other medication, consult with your healthcare provider for personalized advice. They can help determine the most appropriate treatment plan for your chronic pain management needs.